I think this was something that started organically between myself and another few physicians who had an interest in treating endurance athletes.
The goal of the program was to bring together a group of clinicians who have shared goals of working in this community, whether it's with runners or endurance athletes in general. We want to have the ability to meet you wherever you are along your specific journey.
We also noticed that there was no such program in Philadelphia. Here we are in one of the largest cities in the country with a very large running community, but there wasn't the right amount of coordination between all of the physicians and therapists that care for them, and we saw that as an easy niche to fill. One of the other things that people get wrong about sports medicine is they think we're here just for a high-level athlete, but this program is for a wide variety of athletes. If you're willing to put in the work, we're willing to work with you to get you across whatever finish line you set. Running is one of the things that our bodies are best tailored to do. There are so many physical, mental, and social benefits. And when all of a sudden there's a halt to that, it's hard to know how to pivot and regroup.
I was running one day and I started feeling some pain in my knee. It just got so painful that I had to stop. So I went to see an orthopedic surgeon. They found out that I had a meniscus tear and also some arthritis. So I was in a panic mode. The surgeon thought that I did not need any surgery, so he referred me to Dr. V here. And Dr. V looked at my MRI and he did a very extensive examination.
And then if I bring it out this way here, does this bother you? Nope.
So he referred me to a very nice physical therapist. She's a comparative runner.
You're going to see a healthcare provider who not only understands the nature of what you're dealing with, but also has a shared passion for the activity itself, which I think means a lot for patients.
Not every physician's the same, not every physical therapist is the same. And even though someone can treat a condition, there's a difference about treating a population.
If you're a runner, find a doctor that works with runners and find a PT that works with runners. There are many good doctors out there, many good PTs out there, but they not necessarily have the knowledge to work with athletes.
A lot of people think of this activity as something you can or cannot do, but sometimes we need to do it better. It's not so much, should I run, but how should I run?
Our goal is to get to know the patient personally. Why do they want to run? What are the reasons for running? Do they have the goals of just staying healthy, or are they actually trying to compete competitively? And knowing those goals is going to help us develop a specific tailored program for that individual.
I make sure he understands that I had a Boston Marathon coming up, and I could not miss that. Between the physical therapist and Dr. V, they developed a program for me for the rehab. And the PT side, she prescribed me a lot of balancing exercise, stretchings, muscle strengthening, ice machine. On the medical side, I also had the PRP treatment in January, and then he timed the treatment so that I can recover in time to run the marathon. And my condition actually improved, and I start training again. So slowly and very carefully, I managed to run the Boston Marathon. It's been a good journey, and I'm glad I'm back to running.
It's really their accomplishment, but whatever little piece I had in that puzzle, it's why we do it. Don't let an injury keep you on the sidelines. Schedule an appointment with us today and get back in the race.